Hello, you're watching AOTV. We are now going to catch up with two of the participants who have been on the AO CMF Advanced Course. Joining me in the studio, Chen Shen. Great to see you.
Nice to see you too.
And also Osama. Hello.
Hello.
So can I start with you and ask, why did you decide to come on this advanced course?
Okay. I think I'm very early has become AO members. So to Davos is one of my like a dream to attend master courses. And so this time I saw the content because it's quite fit for my clinical practice. So that's why I come here. Yeah.
So Osama, can you tell us a bit more about this advanced course?
It's a fantastic course, great selection of faculty, wonderful selection of topics. The execution, the arrangement of the course has been outstanding. And the course goes into the emerging technologies in orthognathic surgery. So we have developed the industry, along with the surgeons, new tools that we did not have in the past. It used to take us a complete weekend of taking impressions of someone's jaw, trying to record the relationship of the upper jaw and the lower jaw to the base of the cranium, and to articulate all of these into masters of stone, to be able to simulate the surgical movements that we would like to execute for these patients to correct their dentofacial deformities. And now, with the introduction of cone beam CT or cone beam CAT scans, you press a button and you get 590 photos of that patient, and with an algorithm into these softwares, you get a three-dimensional picture that you did not get in the past. In the past, we used to take 2D X-rays or two-dimensional radiographs that allow us to see problems from certain angles, but we have to complement these 1, 2, and 3 radiographs to be able to grasp the beginning of the problem. And now, with the introduction of technologies such as 3D planning, you could execute these surgical movements and plan them in such an accuracy down to 0.5 millimeter. And you could print guides that will allow you to execute the surgery in with such an impressive accuracy. And also print plates. I mean, we used to have the stock plates in the past, and we used to come at a bridging area of the stereolithic models where, the technology was able to print the whole skull of the patient, and then we'd spend hours bending the plates and choosing the right screws in terms of length and width, and you could design those right now. The tools have become so advanced, and the technology have bridged the gap that we actually were suffering from in the past. I'm sure that sticking to basics and knowing how to do any procedure in an analog fashion is one of the key pillars to the success of the treatment of any patient. But with technologies such as the Digital Leap, which is a headset that you wear that allows you to dynamically navigate your surgery. So now we're taking things a step into that algorithm of added accuracy. So it's not only that you can articulate and plan the surgeries with great accuracy. It's not only that you can print the guides that will allow you to decrease the operative time so that the recovery of the patient can be much faster. The movement can be a lot accurate. And also you have those dynamic technologies, dynamic navigation technologies that allows you to further check that you're down to 0.5 millimeter planning and plating is really where it's supposed to be.
Chen Shen, how will this impact your practice?
Yeah, I think the technology change our practice, and we're using this kind of simulation surgery and accurate execute all the procedures during operation, and truly we can improve the patient's the operation post-operative qualities. Yeah, so I think in this course we learn the masters from the experience on applying these technologies into the clinical setting, even discuss about the complications also. That's why we cannot actually supposed to compare to the other courses. Yeah.
Why would you recommend people to make the investment to come to Davos, which for some people is a very long way? But has it been worth it, and why?
Yeah. Okay. So I think, like me, the journey takes about 70 hours, I think. But I think for the Davos Master Course, the difference from the others, like advanced courses, is like they have a lot of varieties. It's not only lectures that have the most important, the debate discussion, the panel discussion, and also mixed with some hands-on experience. And especially, I quite amazed of the short session. They have a demonstration of on the cadaver surgery. So I think for the technology part, we can learn how to use this software. But the soft tissue is another big problem that we cannot learn from these technologies. So with these master speakers, we can learn how they do this soft tissue management. That is what I think it is worth to come here. Yeah.
What about you, Osama? What impact do you think this will have on you, and why would you recommend that people come along to Davos and make the investment like you have?
The diversity of the faculty and the different techniques and the different approaches they bring into the room is outstanding. I've been to a lot of courses. I've been to a lot of conventions or conferences or summits. The way that the cases are presented and the level of complexity and the level of transparency and the sharing of the complications and how you deal with them. You could read a book or you could listen to a lecture, but it's the interaction. So the format, there's a lot of thinking and a lot of effort that's being put into the articulation of these sessions and the choice of topics and the choice of a collection of topics into one session. There is a tremendous amount of work, and it shows, because once they start to show a case, they give you the opportunity to manage it before they show you how it's being managed. And the interaction in the room for this session has been phenomenal. It's probably the most I have enjoyed in my 23 years beyond dental school. I've been practicing oral maxillofacial surgery since 2012, and beyond that, or before that, I did my training. And you go to a lot of meetings locally, regionally, internationally, but this one, I have to call it the cherry on top.
That's great.
It's on top of everything, because the master's classes included participants from everywhere. I think people were not only from oral and maxillofacial, there's been plastics, there's been ENT, and there are different philosophies that goes into the training of these specialties. And to be able to have all of this under one roof, interacting amongst, you've got the giants presenting and sharing what's probably worth of 30 years of surgical experience, and showing their good side, showing their complications, telling you how to do something that you struggle with on case-to-case basis, or teaching you the essence of how to manage a complication. It's outstanding and phenomenal. It's been the best experience in my life. And as we were chatting earlier, I've been meaning to come to this course for about 10 years. And I just couldn't find the time. And I was very lucky this time to be the last registrant on that group. And it's the best decision. It's the best investment. It's the best time off, because that time is the real investment. The course and what you get out of it is the absolute joy of being able to participate and share and counter comment and see where the future is going. It's a marvelous experience.
That's terrific. And you've been part of the AO since 2003, but it's your first time here.
Yeah. Yeah.
Why do you believe that the AO is an organisation to get involved with?
Okay. So I think it starts from my training. And 2003, when I first learned to know the AO. So I think I attend the courses afterward, and I learned a lot of the basic principles and even apply into my clinical practice. So the other things, I think the AO give me another learning opportunity to become a faculty. So I think I became faculty since 2013, I think. Yeah, so by conducting the teaching, I learned more from the feedback.
Yes.
So yeah, I think so the AO not only provides a learning opportunity, it also provides you how to conduct the education. I think this is quite important. And also I expand my connections to international colleagues, different specialties, maxillofacial, ENT surgeons, plastic surgeons. So that is why I become a believer of the AO.
Excellent. So I know it's taken you 10 years to get here, but will you be back?
I'll be back with a blink of an eye.
Excellent. Well, we look forward to seeing you next time.
Yeah.
Thank you both very much for making the time today, and enjoy the rest of your course here.
Thank you very much.
Thank you very much. Yeah.